So my name is Julia Grapsa. I'm a consultant cardiologist at Guy's and St. Thomas's. Also, my other life, I'm editor-in-chief for Jack Case Reports. And I would like to start with Dr. Gina Lundberg. She's associate professor at Emory University in Atlanta, Georgia. And also she's the upcoming chair for ACC Women in Cardiology section. So a lot of work. Also, she's all supervising our social media for Jack Case Reports, and not only several activities. She's our mentor, our guide. Everything Gina is means a lot to us, and also since I said about the ACC Women in Cardiology, there is a transition from Tonya Singh, who is also a part of the discussion today. Hi, Tonya, to Gina. Tonya is the past chair of Women in Cardiology under American College of Cardiology. And we have also Sarah Birkhoelzer, who is a cardiology registrar and also very active in British Junior Association of the society and the group, and organizing a lot of webinars. I saw one that you had in Oxford. Also, she's responsible for the Global Women Cardiology Group. So thank you for being here. I think we'll start with Gina, or any comments
Yes.
before we start? We'll start with Gina, and then we can have an active discussion.
All right. And I'm going to go to screen share now. If hopefully this is going to be on soon. Do you all see it?
Yes.
Great. Okay. And just to clarify, Tonya Singh is still the chair for ACC WIC for one more year. I'm the chair elect, and we'll actually have a great year doing it together. We're going to have so much fun, her being in charge, and I'll be under her wing learning how to do it all. So I think the first year is going to be the best year. I'm very excited. I was very excited to have this chance to talk to you all today. Julia called and was talking about how much burnout, particularly the fellows in training, are feeling. And I shared with Julia that we went through something like this in the AIDS days. So in the late 80s, early 90s, when I was still a resident, we were taking care of all of these AIDS patients who we really had no treatment for them. We really didn't know what we were doing. We were treating opportunistic infections. We didn't have medications to suppress the HIV virus. And it just felt like this small scale of what we're dealing with now. I'm the ACC Communications Chair for WIC, and we've had some beautiful articles from our team on dealing with burnout and COVID. So I encourage you to go to acc.org under the Women in Cardiology section and read some of those. Gladys Velarde did a beautiful one on what it was like to take care of patients during the AIDS epidemic. So let's move on to, what is burnout? So first of all, I'm not asking you if you have it. I'm sure you have it. In fact, I think all of us have it to some degree. And the question is, where are you on the burnout scale? So burnout is a lot of physical things such as headaches, muscle tension, definitely problems with sleep, feeling overwhelmed and cynical, frustrated, unfulfilled. Not wanting to go back to work, whether it's, Sunday before your morning shift, Monday morning shift, or you're going on call for the weekend. It's just this dread of going into work. Apathy, complaining, getting to these negative ruts, just feeling depleted after work. You have no energy to go exercise, go to the grocery, cook dinner, to do anything, and feeling very short fused. I'm irritable, I'm on edge, I'm losing my temper, I'm snapping off at people. Being maybe very much out of character for yourself, but so overwhelmed that you're just ready to snap at anything. So I actually started studying burnout back in 2017. And at that point, of course, we didn't have the pandemic, but we were seeing these different stages of burnout. And we were also seeing how it affected women more than men, and that women were committing suicide at 400% the rate of men. And so it's just really gotten out of control with COVID and the pandemic. So the stages and the early stages are compulsion to prove yourself. This can be a little bit of imposter syndrome, which is what we've talked about before. Just feeling like if I work harder, it's going to be okay. And neglecting yourself personally, maybe not eating as healthy, not getting your sleep, not taking some time off, turning that phone off, getting a break. I know we can't really travel right now with vacation, but just a weekend at home, a staycation, it might be just what you need. The next phase is displacement of conflict, just suppressing your frustration, suppressing your anger, getting mad about this when you're really mad about that. Revision of your values, feeling like, well, I just don't have time for the things that are important to me, maybe my family or my faith, because I've just got to work harder and harder. And then denial of emerging problems, trying to pretend like you're not feeling overwhelmed or you can handle this. It goes on to depersonalization, obvious behavior changes, a point where your colleagues and friends are saying, hey, what's up with Gina? She sure seems to be snapping a lot lately. And then withdrawal, just not engaging in conversation, not checking in with family and friends, not checking in and doing your usual socialization. And then there's burnout, depression, and then inner emptiness. And these all are starting to be signs that something more serious, like a suicide, could be growing closer. So these are the different stages. I think most of us are already down here in burnout and depression and really needing some relief from this. I think it's a lot harder for women. And as I said, we've got several really nice articles on our ACC.org under Women in Cardiology section, because the women are bearing the brunt of the gender roles, right? We still have children to raise, or the grocery shopping to do, or the cooking to do, or maybe we're caring for an elder parent, trying to homeschool kids. I think the women who have it worst right now are the physician females who have small, lower grade children who really need that help with learning to read and write, and they're not getting that at school, or maybe aging parents, this type of thing. So the women have definitely had more hurdles with not only the incredible demands at work, but the gender roles. Another thing that you all are probably experiencing, a lot of the hospitals in the United States decided we needed to cut back on the physician salaries, basically to float a loan to the hospital system. So I work for Emory Healthcare, and all the physicians' salaries were cut by 30%. And yet in the clinic, I'm seeing a volume of about 120%. I'm way over my RVUs. And so we're all feeling frustrated because we're working harder and we're making less money. So what can we do to avoid burnout? So first of all, let me say that I have not avoided it. I feel it. There are days when I'm really frustrated, and I was trying not to share that with my team. I'm the director of the Emory Women's Heart Center, and I felt like I was supposed to be strong for everyone else. And then finally, just about a week ago, we had a meeting, and I just opened it up with like, I'm exhausted. We can't plan Heart Month. That's silly. Why are we doing this? I'm just exhausted. And I found out from the rest of the team that they were so happy that I shared that, because it felt more real. And they also felt more comfortable talking to me about their struggle. So let's first get real and admit what we're feeling and not try to be strong, because maybe somebody needs to hear that you're struggling too. Something that's always helped me is my faith. If you have a higher source in your life, if you have faith, if you're a spiritual person, then you feel like there's a higher purpose in what you do, and there's meaning to your life. And even in the struggles, you can still feel grateful, and you can still praise your maker. I think that helps a lot. Having meaningful relationships in your life, whether it's a partner or a spouse or a family member or just a best friend or a good friend, you need to continue to engage, even if it's just a quick text, how are you? I think the most important question we can ask anybody right now is, how are you? And invite people to share those feelings. Having mentors who encourage you. Maybe they've been through something before, like I was saying with the AIDS epidemic. Maybe they have words of wisdom or encouragement for you. And try to enjoy your relationships at work. I really enjoy my patients. I try to laugh with them. Many of them are very, very sick and afraid, but they may just need a laugh or an encouragement. Remember, we spend a lot more time at the hospital and at the office than we do with our own family. So try to make those connections where you are. You want to physically avoid burnout. You've got to take care of yourself physically, and you've got to get your sleep. But one of the problems is when you're at work, you wish you were home sleeping, you feel physically exhausted, and then you get home and maybe you can't sleep because you're so restless thinking about all the things you need to do at work, or just dreading going back to work. So try to turn that off and get some sleep. Really, you got to keep eating healthy and exercise. I haven't really had time to exercise like I should, but I wear my Fitbit every day and I try to get 10,000 steps. And sometimes a short walk with the dog at the end of the day gets me those 10,000 steps. You also need some quiet time. If any of you know me, you know I love social media. I'm very active on it, but probably in the last 3 weeks, I've been very inactive. It's crazy in the United States. We've had this election. We've had so much political unrest, racial unrest, and then, you know, crazy people attacking our Capitol. It's been very, very exhausting. And I just haven't been able to engage on social media like I used to. And actually finding some downtime has been very positive and good. We've got to monitor a burnout just like you would monitor a blood pressure, right? So you need to check in of, am I feeling overwhelmed? Do I need to ask for help? It is okay to ask for help. Hopefully you have a safe group where you can talk to peers or family or friends. I have a WhatsApp chat group with several women who I love and trust, and that's where we vent and say things that you probably don't want anyone to know you said, but you need that. Also feel free to grieve, to cry when it's appropriate. Share your negative emotions. Don't suppress them, but don't stay there. You know, once you've vented and blown off the steam and talked about how horrible things are, get back to something positive. Try to start each day with a positive moment, whether it's a thought, a prayer, a devotion, just some kind of heartwarming encouragement. Start your day with a very positive thought, and hopefully it can stay there for a while. I'm going to close with a poem that I wrote earlier during the COVID pandemic. It was actually in the ACC Cardiology magazine. And I wrote it at a time when I was feeling very proud of the healthcare workers, very sad for the ones who've died from COVID, but proud that we were fighting this. And I think we need to keep focusing on, we are proud warriors in this battle, and we're going to defeat this thing. And we're getting a terrible amount of experience, wonderful, wonderful, rich experience in critical care, learning new things. And at some point, you're going to look back on this time and realize, yes, it might have been the worst of times, but it's also the best of times. So very quickly, the poem. And the people went to work, and they wore masks and paper gowns, and they cared for the feverish and the weak, and they bathed them, and they fed them, and they took them for testing and fluffed their pillows and gave them medications and IV fluids. And they held their hands and wiped their brows, and they tried to give comfort. Someone listened, someone wept, someone prayed. And the people learned about the virus, and most people got better, but some people died. And the visitors were unable to come, and the schools and the churches closed. And the people appreciated the doctors and nurses. And the people thanked the first responders. And they were steadfast in their calling as healthcare workers. So I hope that stimulates some discussion. I'm going to turn it back over to the group. Let me find the button. Uh-oh. Let's see. I might have you take it back over, Sarah.
I'm not sure whether I can.
It's down. Oh, here it is. It came back.
Great.
I have stopped sharing.
Fantastic. Sarah, thank you so much, Gina. That was inspiring. Sarah, you go first.
Yes, thank you very much, Gina. I think that was a really nice start for an open discussion. And we were planning to go into breakout rooms, but I wonder whether with the amount of people we have, whether it would be valuable if we stayed all in one room. How do people feel?
Yeah, maybe it's better. Great, I think we have a consensus.
So I don't know whether I may start the sort of discussion and my experience. For those who have followed me and my book club on Twitter, they might have gathered that I had an episode of burnout, as many of us or many of my healthcare co-workers have, and I've experienced a lot of that from my colleagues over the last year. So my episode when I started registrar training, and I just overworked myself. I didn't treat myself. I didn't sleep enough. I didn't exercise. I didn't do all the things that Gina advised us to do. And I think this is a wonderful advice, and it's so simple when you hear it, but we don't do it on a day-to-day basis. And for me, it really helps starting the day with a positive thought, whether that is exercise, breakfast with the children, a nice conversation with somebody, because it lifts the morning. And once you started a day on a positive foot, I think that's a good start for the rest of the day. And I wonder whether people in the group can share their experience, how they overcame their burnout, to share as something we can maybe do for ourselves.
First of all, I think it's very important to understand how we experience this pandemic. And I think after discussion with Yuna, who is here today, we felt our trainees actually experienced this as you described it, Sarah, and this COVID fatigue, as we named it. I would like to ask from all of you if you have heard colleagues, or I will say my personal experience, that I felt that during the Christmas period was awful, because not only for us, that it was not that I worked, because I didn't work a lot. My clinical schedule was quite balanced, but it was mostly the fact that I missed my family. And eventually what I realized is that we didn't have this interaction of that someone would ask me, how did you spend your Christmas, how did you spend your New Year's Eve? They were simply how to respond to the hospital needs, and this catastrophology of that is we will find the Third World War in the hospital going back, and which is, I mean, we have a lot of deaths, we have a lot of admissions, and we are at the worst of COVID. However, I think a very important attitude is, okay, we have a bad situation, how can we grow and help each other, how we can work together, how we can help this, we are at the, it's different to say, oh, we are at the worst at the moment, different maybe to say, oh, we are at the end of this and soon we will have a solution, we have already been vaccinated. I think it's a very different way of thinking thing. Either you will see the glass half full and you will encourage your colleagues and yourself, either you will see the glass half empty and then we'll start all together being depressed. That's the way that I'm thinking. And if I enter the room and I say to my SHOs, oh, today is going to be a very bad day, we have a lot of intubated people, spreading stress, spreading negativity, I think it's the worst thing that I can do. As I'm not sure, Yuna, we are working together with Yuna, and I just wrote Yuna to a colleague that I'm sorry, but I cannot read an email that is more than two lines long. Like I'm really, that's true. I was maybe a bit harsh, or maybe this person thinks that I'm a bit arrogant, but unfortunately, that's the truth for clinical matters. I don't know what's your feedback and how you have experienced all that.
I think it's very difficult, isn't it? I think for the first, we've had two main waves in London. The first wave where everyone was very enthusiastic to try and dig in and help and try and get through the process. And then we spent a lot of time in the stabilization phase of trying to recover our normal work. And by August, we were all exhausted, but we're able to take some time off. And then it starts again in December, where everything has stopped, and it's quite stressful for everybody with changing rotas every couple of days. And then we know now there's going to be another real hard slog trying to get work back up to where we were before, even though we're all working twice as much as we would normally work within the NHS. So I think trying to keep a positive attitude like you have, Julia, generally, for the people that you're working with and surrounded, and we can all lift each other up on different days. And when I'm feeling bad, just chatting to you helps, and to try and keep each other going, basically.
I think to discuss with each other. I want to ask everybody, did you have any trainees coming to you and say our training has been delayed, or those that you are in training, whether you feel that because that's a common complaint that we get, that for example, the trainees, that they do not get as much as hands-on as they should have had, which is, or they are deployed in intensive care unit, or people that they were doing research deployed in clinical positions, so they feel quite rather frustrated. Do you have trainees coming and saying about their training? How would you address that?
Well, we're getting that at Emory. It was worse in March, April, May, June, when we just sent all the medical students home. We tried to pull the residents out of high-risk areas, the fellows, and a lot of people didn't get the numbers they wanted for cath experience or echoes or TEEs. And, they felt very wary and lacking confidence to go, particularly the graduating ones, to go out and start being a real doctor. But I think a lot of the training, we do things, to do something right, you have to do it 10,000 times to be an expert. And think of it as almost like muscle training, muscle memory. You do something over and over again and you get more confident at it. I don't think we let anyone graduate who was not capable. They might not have been expert. They might not have seen every complication that could happen, but you can go read Jack case reports and learn all about complications. But I think some of it is every person leaves their training feeling what we call imposter syndrome. I didn't get enough training. I'm not well prepared. And then they get out there and they sort of get thrown into it and they realize, yes, I am well prepared. So I think it's more of a theoretical lack of training as much and more of a lack of confidence. I think that the trainees are going to do fine. I think the other thing you have to take into account is you're getting more critical care training than you ever would have gotten. And learning about new things and seeing how the scientific process works out and how live research. When have we seen a vaccine approved in 6 months? These are all things that are changing science going forward. I think we just have to focus on, you are well trained, you're getting a different experience that's going to pay off later, and it's all okay.
I can certainly echo this from a trainee perspective. We have had conversations in our department that juniors feel they don't have lack of training. Obviously, the sort of chat over at the bedside might be a bit shorter due to the time pressures, but in particular in the UK, the trainees have developed the BJCA TV website where all the training is now national and recorded, so accessible to all. And I think what a lot of trainees might not realize is the things that they can learn, they don't even realize they're learning. They dealing with uncertainties, dealing with a group of people that might not have low morale or might not be motivated, or extracting learning out of every interaction. And I think this is what trainees sort of, we are used to being spoon-fed and having national training days and sitting at the bedside and having one-to-one teaching, but actually now we have to take the initiative and learn out of every experience and learn with the consultants, because this is all new for them, and realizing that they have to deal with all these things themselves. And like you said, with the intensive care experience, dealing with the acute unwell patient, surely that might not be the right hard catheter they have to be ticked off for their portfolio, but it's an experience they will have for all of their life. And I think it's the sort of searching for opportunities, and some of them, they might not even realize what they've already learned in the last year.
For those that they cannot be really hands-on, would you give the advice, for example, to focus on writing, or to focus on aspects that they wouldn't have the time when they are fully clinically committed?
You're asking me, Julia?
In general, yes, because for example, um, I have, I'm speaking from an imaging perspective. That of course, let's say TOEs, the TEs that we have. I know that in the United States as well, you don't do transesophageal echoes because of the risk of contamination and everything. So I think that means that their numbers will be lower this year. And how do we address this? So do we say, okay, now it's your time to write a paper rather than focusing on your TOA certification? Or how would you address this issue?
Well, I think, Julia, I mean, this year of all years, or 2020, from a theoretical point of view, we've never had as much online learning as we've had it's one of the big positives that's come out of 2020. I mean, I've been virtually to 5 or 6 major conferences this year that I would never have got to. Many of them free, or for a very minimal price. I think in the UK, because of the time of the schools changed, I haven't got to the ESC in 10 years because of children starting school or changing from primary to secondary. So I think that's one of the major positives that's come out of it, has been the ability to get world-class research and presentations from world-renowned experts on your iPad, on your phone, and that's all freely available. Now, I appreciate that's not the same thing as doing a TOE, but it's really, it's a massive opportunity, both for the trainees and for consultants. People have said to me, oh, we haven't been able to get CPD. I'm rolling in CPD this year because we've so much of it. It's been, that's the big positive I've taken from it.
Yeah, that's a great positive aspect of this, because you're right, because almost all the meetings are free.
Mm-hmm.
And a lot of webinars. And going now to the webinar, since you mentioned that, we have a lot of Zoom meetings and a lot of meetings in the hospital. And do you feel burned out from this? Do you feel that, actually Yuna said that our workload, I think, it has doubled, because in between everything else, we have 1,000 meetings to attend for management, for COVID, for everything. So do you select the meetings? Do you try to manage your time to attend everything? So how do you manage your time?
I'd like to say something about that. One of the challenges with anything in life is to find out where you want to put it on your plate. And I think that in some ways, COVID has kind of forced us to set boundaries, which we didn't have before, where we were, like Julia said earlier, that we would get long emails and we would get multiple emails. And I think that for dealing with my practice, and I'm on staff at 4 different hospitals, which all generate daily emails about the COVID situation. I have chosen to be very selective about which email I open, how much of it I read, and trying to find the value in things. So I have been able to recognize this is maybe a value to me and this is not. And also recognizing that sometimes if you miss some things, if it's important enough, somebody else will reach back out to you for it. So I think that setting those boundaries, and also then taking time off where you take yourself away from a meeting or an email and say, after 10 p.m. I'm not looking, or after 9 p.m. I'm not looking at my phone because I'm not on call today. And if somebody really needs me, they will call me physically on my house or my cell phone or leave me a message, rather than me being on hyper alert to be checking messages. So I think that it's also important for us to realize that we are important, but we are not irreplaceable, and we don't have to be on 24/7, and we don't have to read every email, and we don't have to respond to every email. And I think that is something that I have learned from this year, and I've gotten better about managing that, and I share that, in all honesty here. So
You remind me a discussion that we had last night when we had the editorial board meeting, and one of the colleagues said, remember my advice. Just because you are receiving an email doesn't mean that you have to reply to it. So like, and you need to like a screening. Of course you will reply to these emails. So for example, I've written on my list 2 more things to do tonight, and I think that's my aim the last few days, to 10 o'clock, to say I'm switching off everything. I will watch something TV, or I will focus to the family, and like try to relax. Otherwise, if you keep going and going, and then it's non-stop, isn't it? And I think this is the life work. So how, this is the advice that you would give to our fellows, that, or that they should actually try to find the time to pause and have time for themselves.
I think it also becomes a cultural issue if you as a leader are always on your email and are always expected to respond within 30 seconds, your team also feels that pressure. And I think by setting boundaries as a leader and by having sensible rules, you're allowing your team to have better life work balance, or better, at least better downtime, where they say, you know, if they email Julia and she responds within 30 seconds. If they email me, if I don't have my phone, I will look like a slacker. So I think by setting those expectations and speaking them out loud and saying that is okay, and I will get in touch with you by phone if I have something important to say, but I don't plan on sending any important emails. You can even set things up in your email sender so that even if you want to send an email, it actually doesn't get sent out till 7 a.m. the next morning or something. We've started doing that in our practice, because we have 160 employees. We have like cut back. Nobody's allowed to send emails to the entire practice. Nobody's allowed to send emails, during work hours that are not important. So we have really worked hard on setting this culture so that there's not this constant dinging of the phone. But I think you can lead that culture as a leader or a team member.
I think it's also very important because that's really transferable to the rest of the specialty. And that's not just answering your email, but also, women in the cath lab who don't feel they can do interventional cardiology because they are not allowed to leave at 5 or 5:30 to pick up their children, because they feel, all the others stay late. All the others, we have 2 interventional fellows, and they share the week. So they don't just share Monday to Friday, they share the week. So it's expected of them to come in on a Saturday. That's just part of their job. And I think Eleanor will support me in saying that some of our seniors, they are having a week off, but they just managing that week by catching up with everything else. So during their week off, you're finally able for them to read your paper. You finally get feedback from your research project, when in fact this should be their week off, and they're filling it with things that were left over, which then we feel like if I say I'm not working on weekends, so I'm trying not to work on weekends, because basically I don't have childcare on the weekend and I want to have it free for family. But it sometimes feels when people ask me, oh, can you do this? And I say, well, the next time I'll be available to do that will be Monday after work. And I sometimes sort of get a bit of a look, so to say, well, other people would do that on the weekend.
I think that if that becomes a general principle, that people recognize that there is protected time and it's okay to have protected time. In my practice, we have people with very young children and people with older children, people whose kids have grandkids. So that everybody's life is different, but that doesn't mean that just because I'm the leader of the group and I don't have to get home at 5 o'clock, take care of my kids, I should expect the same of everyone. And I think that is really important. And again, I think it starts from the top, but I think sometimes leaders don't realize that they're setting that expectation. They don't think that they're setting, and I think sometimes having a conversation with them about it in a pleasant, non-confrontational manner might help them recognize that issue.
And also is the demands that leaders may send you non-stop emails about we want this and want what I've noticed, you will rarely see them volunteering. Isn't that so? Don't you expect that the people that they're demanding and they say, oh, there is a national crisis, they would be the first ones to volunteer sometimes? Isn't that set by example? I don't know, my impression, but this is what I've noticed. Not everybody. I mean, few colleagues in the hospital, They are very on it, and they were the first to do ward rounds. Just I'm talking in general. We have actually few men also in the company, and I will give the word to Ahmed because he wants to share also his experience, and it would be nice to hear how he experiences burnout. Ahmed, you are muted, by the way. I'm not sure. Let me unmute.
Yeah, I'm muted.
Hi, Ahmed.
How are you, Julia? How are you?
Hi, nice to speak to you.
I found this, most of us have reached a burnout stage because of the COVID and the stresses we are facing every time. And though we have so much time that we don't spend on work, and we should work more on our research projects and so, but you are not motivated to do so. And I think this forced me to think more about my personal life and how to improve myself and work on myself a little bit more. And surprisingly, this has reflected in a very good way on my work again. I'm now more fresh going to work and doing my job. So I think it's time to think about your personal life and personal well-being more. I think this year have changed me in this way a lot, I think.
So you were doing research, Ahmed, and then you decided that maybe you should focus on the clinical aspect at the moment, and then is that correct?
Yeah, that's right. Because that's all the procedures we are doing, like the transvaginal and the invasive procedures, is a little more less this year. So you have so much more time, and we can focus more on some clinical and research more rather than the work itself. I think this helps a lot.
That's a positive aspect.
Mhm.
Gina, you want?
Well, I would add to that that you did the exact right thing. So if you're experiencing burnout, but you have this idea, oh, I just need to push through and keep working, you're only going to get worse, and you're, running on fumes. You have, nothing there. You've got to step back. You've got to take some time. You've got to heal yourself. And generally, if you've given yourself that time, that rest physically and mentally, then you can come back recharged. But when your batteries are dead, you can't keep going. You got to stop and recharge. And I'm actually really pleased to hear that you're finding some renewed joy in your job, because that does mean that you're, getting out of the burnout. Don't overdo it, set boundaries like you've done. But we all need a break. We all need rest. And to a comment earlier about if somebody says, I'd like you to look at this, and you tell them I'm going to do it Monday. Well, first of all, Sarah, that's great. And you never need to apologize that you're not going to do it. You don't even need to give them an excuse. You just say, I can't do it till Monday. No excuses. You don't need to explain to somebody your priorities at home. But I think once they've heard that a couple of times, one, they're going to know that's your answer. And two, they might start to think, that's a great idea. I need to start saying that. I need a little downtime. And you might start to have influence among your colleagues. I think so many of the young men I work with are thrilled that women take maternity leave, because they want to take their paternity leave. They want to be there, but they hadn't felt validated to do it until the women made a stance in that area. So take the time you need. I bet other people will be glad you did it, and they'll follow your example.
Yeah, I totally agree with you, because I had experience with this. When you tell someone that you are only available on specific times, the first time they may get angry a little bit, but with time, more and more, they know that this is your appointments and this is your time. And they ask me in the times I specified for this. So I think this is a good idea. It's not a bad thing.
Well, I feel encouraged to use that even more. I feel like we should have like a sign on our door, only available between 8 and 6 during the day, not out of hours. I think, so what I just want to mention that, again, during maternity leave, I do feel, although I might not have slept much during the last year, but I do feel my mentally I'm much more fresh than those who've worked during the pandemic. And what I thought was really valuable to me and my well-being was having a friend like Claire Bannister, who's on the call, who we were planning to do a couple of projects in end of November, and And she said, Sarah, you've got 4 weeks left of your maternity leave. I'm not going to hear anything from you for 4 weeks. We can all sort this out in January. I did post a couple of messages sort of weekly to her with some well-being pictures to make sure that she knows that I take it seriously. However, I would like to ask her how she thinks we can improve well-being in cardiology, because we were thinking as part of the British Junior Cardiologists Association to have a well-being officer as a role who takes on to improve well-being in our specialty.
Yeah, sure. No, thanks, Sarah. I mean, I think having this open discussion is, I wish I could do it with everybody within all of cardiology. I think just having that ability to be able to talk to other people and know that they have your back is something that's so valuable to me in terms of my own well-being at work. And I feel like as a trainee, I've just come back from maternity leave, which is, you know, I'm at a bit of a low confidence from that point of view. I'm also less than full time, so a bit low in confidence from that. But I think in terms of my own well-being, talking to other people, knowing that they support me regardless of everything else that's going on, and they really do have my back if I have a problem, that I can go to them, I can be honest, I can talk to them, they will support me. And that goes from the whole team, that's the SHOs, the registrars, but most importantly, I think from the senior team, because I think that I value their opinion so much and what they think of what I do. And if I get a hint of anything negative from a consultant, you know, or someone else in my team, it really does knock my confidence. And I think that having that support network at work is so important. And I think I don't know quite how to address that sometimes in terms of when I'm looking for support from consultants. I find it quite nerve-wracking. I think a lot of registrars do as well. But I think just talking about it to other people and having, you know, a mate at work is absolutely vital, particularly in the current times. I think the other thing I've been thinking about well-being, you know, is what we kind of touched on earlier, that, you know, annual leave is supposed to be annual leave, and I feel like in a lot of places that I've worked, that just really isn't sort of respected in a lot of places, not through any malice, but like you said before, just because that is the only time where you can actually catch up and do your research or your papers or your whatever else that's on your to-do list. And I think that actually, to be the best doctors that we can be, we have to have annual leave for our own health and mental well-being, but yet that isn't protected. And I think I would love to see that more spoken about from my seniors and my bosses and my peers, just to say, oh no, I'm on annual leave next week and I will get back to you, like you say, Sarah, on Monday, or the week later, rather than saying, oh no, I'll look at it during my annual leave. And I think if your bosses said that, then you might feel more happy that you could do that too.
Very nice, very interesting, and you give us a lot of you know, to think about. I would like, if you don't mind, to ask Elena Cowan how also she experienced this pandemic and the COVID-19 fatigue, as we call it. Hi, Elena.
Hi. So I'm just actually coming out of burnout, and I never thought it would happen to me. Obviously, I read about it, but I didn't think I would be the one affected. And it's unbelievable that you physically cannot do what you used to do before. And but luckily, I think in some ways, maybe it's good that it happened during COVID pandemic, because I think people were more understanding, and I was able to take some time off, and I was able to have some sort of support from colleagues and Sarah especially, and actually in terms of emails, I have been to one of the research well-being webinars, and what people suggested, actually, for first couple of hours in your day, you don't open email at all. So you focus on what you need to focus. And then, okay, during, say, some sort of, if you need to take a break or or whatever, you can check the emails briefly and then go back to work. Because I think, unfortunately, probably lots of us have this habit, well, I need to check email, I just need to ensure I'm not missing anything. But actually, as you say, if somebody really needs you, they will find you. And I think probably with COVID as well, probably didn't help that lots of us were pushed to do something which we didn't do before, out of the comfort zone, something which we wouldn't agree or wouldn't probably choose to do it in sort of like normal times. And I think, again, sort of it's affected the well-being. And during first wave, I was part, well, and still part of COVID research team in hospital. And it was incredible that, so we were doing this recovery project, and as compared to some clinical decisions we have to make, say, as a medical registrar call or cardiology registrar call, I think the decision we had to make, research nurses or research doctors, were not so significant. But at the end of the day, research nurses and myself, we were coming home completely shattered. And we were surprised to hear that lots of us never felt so tired in our life. And I think the advice which was given here, I completely agree that exercise, trying to eat healthy, it all should be part of the routine. And also I think
Elena,
I
have a question. So how did you realize, where was the time point that you realized that you were burned out? Did you feel that the time was not enough? Did you feel like you are in low mood? Did you feel you couldn't sleep?
I think probably I reached nearly sort of like the final stage. And it's sort of like maybe because you're sort of like burnt out, and my sort of relationship at work with some colleagues were really sort of like deteriorated. Maybe again, as you said, that sometimes we forget that other people have other priorities in life, and somebody doesn't want to spend time sort of like during the weekend doing something work related, and then it creates sort of like disagreement, and then it's sort of like at some point it just escalated out of the proportion completely. And I think somehow, because at some point the sort of like conflict at work got really bad, and I was about to lash out at colleagues like really badly, but somehow managed to contain myself. And looks like they were realizing as well. They realized that I'm not right, and they suggest you need to take time off. So I took some time off. But I think probably, just looking back now, maybe I wasn't fully aware that I was sort of like not right. And now it's so fascinating when you listen actually and actually take into account about burnt out. It's just so fascinating that it's like a textbook situation. So, and it's not really nice place to be. It's just looking back, it's just so horrible. So
I'm really sorry to hear that, but I'm also on a positive aspect. I'm happy that you are now at the end of it and you're trying to.
Yeah. And actually, again, it's just quite difficult, because obviously now, sort of like having had this experience, you sort of like trying to be really careful. But the last couple of weeks I felt much better, and actually probably had some days when I managed to do something sort of like, well, it probably sounds bad, when I did some work outside of work, which I used to do before, which again, probably not the right thing to do. But obviously now, sort of like learn from that. It's just like, I just try to tread carefully, sort of like not to push myself too much. So.
You know, you remind me, I will say only this thing, that a friend of mine is an actor back home, and he has a theatrical school, and he's doing online sessions for that anyone can join. And then it was a good opportunity for me. I attended like a musical class, like theater, and that our teacher was like so happy and singing all the time, and you know, this figure that you see in musicals and opera, that I was like me spending 1 hour of my time sitting there and looking at him, and I was laughing. It made me feel that was something completely out of medicine, and they had no clue who I am. They didn't care who I am, but it was there making us laugh and making us having a nice time, and literally being able to get my mind off of what's happening. I think that's important, isn't that?
Yeah, and I think yeah, unfortunately, I think in medicine we are so career driven, and probably lots of competition. You go somewhere, you don't understand what people are talking about, you feel bad, you try to read about it in your own time, and sort of like it's escalating. But I think you just need to have time off out of sort of like specialty and development. And I think different people have different sort of techniques. For example, I like to watch crime dramas, and it's just something like really takes your mind off sort of like all the work issues. And so
One
Yeah.
of the I had about 30 slides for my presentation, but I told Julia I would trim it down to 4, and I didn't even do that. But one of the things I cut out was that music can take us away, that adding, listening to music, cooking or hiking, or just, knitting, pottery, anything that you enjoy that is a completely non-medical, that it's a distraction, that it takes you away. A mindless activity is so important to have that. Some people get on Candy Crush and some people binge on Netflix. But you need something that is really mindless that you can do, that just gives you some downtime. And Elena, I want to just say how courageous you are that you shared that with us. A lot of people would not have, but trust me, people need to hear that people they respect and admire, who are very successful like you are, still get burnout, that no one is beyond it. And it's important to talk about it, because probably somebody heard you today and they're really going to take stock and self-monitor and hopefully avert a crisis. I think once you've been through it and how bad it can be, you'll do a better job of self-monitoring. You'll probably also be better at picking up on it in your colleagues. So just thank you so much for sharing that. I know that was very personal and we all appreciate it.
Yeah, I would like to echo that as well. I think as from sort of summarizing the evening, as trainees, we look up to consultants and don't realize how many people look up to us. And they don't even have to be in a sort of junior level to us, that just other colleagues look up to us. And if we just share our vulnerabilities and the fact that we're human, we're interested in each other's well-being. It's really lovely to have that discussion today, that we shared our problems, but also focused on the opportunities and the way we overcome them, and just to bring that in the forefront of our mind, that how important well-being is. And I'm really grateful for Claire also to sort of put well-being as the highest of her agenda, both in her sort of life just as a friend, but also in cardiology. So hopefully we will be able to get a sort of role as a wellbeing officer at the British Junior Cardiology Association. And I hope I don't just speak for myself, that I was really inspired from everybody hearing the stories and contributing this evening. And I'm sure once we put this online, people will get inspired without having been able to be here, because they're serving on the front line. So thank you very much for everybody attending.
Gina, thank you so much as well, and everybody who attended this, and really grateful. And like, be kind to one another. I think that's the main message. Gina, would you like to say something at the end?
I'm just very honored to be part of this. I think it's very important to discuss it, to share how we feel, to have a safe group, and to like I said, the most important thing you can ask somebody right now is, how are you? And spread that joy and start your day with something positive.
Thank you.
Thank
you so
you.
much.